dealing with a case of central low back pain. In this case, maybe low back pain slightly to the left of center for when we demonstrate these techniques. You may have a thought that you have discogenic degeneration, resultant discogenic instability, but the fact is if you don't have imaging, you really don't know for sure what the symptom producers are. Likely it's neoinnervation of a degenerating disc, neoinnervation of the annulus fibrosus. Perhaps it's an upregulation of biochemicals within the disc, an increased upregulation of cytokines within the intervertebral disc. Perhaps there's an end plate fracture and a resultant modic change in a vertebral body above or below a degenerating disc. And as a result of that, there's bone marrow edema within that vertebral body. Any of those things are common symptom producers in our back. So for this technique, we're not thinking biomechanics, we're thinking neuromodulatory and fluid pumping oscillations. For this case of backache, central, maybe just left of center. We're going to trace the lowest rib, rib number 12, right to the L1, L2 junction, and then contact with the ulnar portion of our hand the L2 transverse process and deliver a grade 1 neuromodulatory mobilization and then a fluid pumping grade 2. And then move down to L3 and deliver a grade 1 and a grade 2. And then keeping your hand so that just the ulnar portion of your hand is contacting the patient. We can get just above the iliac crest, contact the L4 TP with a grade 1 and then a grade 2. And then lastly, we're going to indirectly oscillate the lumbar spine through the pelvis by applying a grade 2 right over the top of the PSIS. We should work at about 30 seconds per segment with both the grade 1 and then the grade 2 oscillatory pressures in an effort to reduce discomfort through neuromodulation and perhaps mobilize some of the fluids that are associated with the pathologies that I just mentioned.